Okay, now let's go to the EMIS access and what happens when patients access their medical records. But once you put your passwords in and you want to order your repeat prescriptions, this is the screen that you get. It tells you about them, and this comes straight off the repeats that we've typed onto the computer. So as clinicians, we don't actually do anything different. We just continue doing what we're doing. And all the system is doing is pulling the data out and making it available for patients to see. So this is the repeat screen. This describes how to take it, and this describes when it was last issued. So you can see, for instance, that the GTN was issued on the 2nd of June, but you can see over here that this particular tablet, that's erythromycin, let's take another one, Monomil XL, was last issued in October 2008. Now the question that one would ask is, well, why do they not continue to take it? And often I find that patients themselves might not necessarily know why they're taking the medications or what it's about. But if someone else could see that they haven't ordered that tablet for 6 months, it might trigger a question for them before that patient ends up in A&E because they've not been taking their tablets. You'll see next to each tablet there's a little I button, and if you click on the I button, it'll take you to a website that tells you a lot more about that particular tablet. This example is aspirin, and you can save it as a PDF or you can print it. Patients who are ordering repeat prescriptions online think this is absolutely fantastic, and they've learned a huge amount of information. Interestingly, it hasn't belittled the conversations that they're having with their doctors or nurses. They've never said, why has my doctor or nurse never said this? What they've tended to say is, gosh, I've had this condition for 20 years, I've been on this tablet for 20 years, and the internet's told me stuff I never knew about that particular thing. So it supports their understanding rather than creating problems.
Many people coming in asking about side effects and sort of contraindications.
No, quite the opposite actually, because they can see it. And actually the side effects and contraindications are the very same things that are in the leaflet anyway. What I found is that they find it's just much easier to read than the little writing on the page. But no, I haven't seen any increase in people saying, I've been on the internet and seen this thing and it suddenly tells me more. They have noticed interactions though. The interactions bit they seem to find better at reading, which they find very difficult on those leaflets. That's the one.
Sorry, I was wondering, what's your experience about people probably with all this information trying to get ahead in the referral system? For example, back pain. Some people who just believe, look, this needs to be sorted out, and they say, look, I have these alarm symptoms, I have this, because they know exactly what you're going to do next.
It's no different to the patient that's read something in the Daily Telegraph and comes in and says, I know a little bit more, than the next patient who just doesn't read anything. And, we're now in the information age. It's no different to someone who's spent an hour, 2 hours on Google, found a website that gives them information that says, maybe I've got this, that and the other doc. The problem is that it's very hit and miss. 2 days ago, I had a patient who came in and said, Doc, I've heard about this new tablet that purifies something from tomatoes. Can I have that? And I'd never heard of it. I said, what are you talking about? Oh, it's all over the news. I said, I've never heard of it. So the next day, in my tray, was this 5 pages of stuff that he'd printed off from a BBC News website about someone who purified something in tomatoes. And some experts saying how wonderful it was. And, at the moment, people are going to anything at all. What I'm doing, and what I'm encouraging patients to do is, let's go to NHS Choices, let's go to the map of medicine, let's go to the page that I'm reading, so that actually when you come in and say the map of medicine suggests that I need a CT scan or I need to be referred, I say, oh, thank you. You're following evidence-based medicine, the very tools that I'm using to help deliver care. You're telling me where you think. My job just then becomes, is this right? Is it true that that's the history and that's the examination? Has the patient got the understanding right? But actually what I find is it saves me huge amounts of time. Instead of me having to do it all, patients have done it and said, this is where I am, this is what I think it should be, can I have that? Booking appointments. We've got appointments booked up to 6 weeks in advance and patients just love it. Instead of ringing up on the front desk and just being given the next available appointment, they can actually choose very carefully and sit down with their family and just pick whichever appointment they want. When they do go into the full access to the full record, this is the screen that you get, so you can see the allergies, what medications, repeats. Down the side you've got the summary record, the consultations, results, letters, medication, reports, and so on. As we move further down, this is a significant active problem list, and notice how they've got the conditions in chronological order, and again next to each one there's a little information button, so they can go to websites that tell them more about obesity, asthma, or whatever else it might be. We've also got it in system order because feedback from patients was that they found this information quite difficult to understand. They found it easier to say, this is my chest problem, this is my nervous system problem, this is my heart problem, and so on. So it reorganises it in a form that patients find more easy to understand. And then family history. Again, that might be useful if that patient was to present that record in the A&E department or the out-of-hours department, and you knew that this is a patient who's got a family history of diabetes or heart disease. It starts to get you as a clinician to start thinking a little bit more about, could this be some sort of odd presentation, one of those things. It's potentially useful information. And then the most recent test results. Consultations, when they click on consultations, this is the information that they get. So for instance over here, this is a consultation that the test patient has had on the 8th of June with me. It's renal failure. I've written in the comments in the free text, blood test going off, not sure why, has been under the rheumatologist for a while. Email them and ask if they need to be seen urgently in the clinic or not. But if that's the 8th of June and this particular patient presents to you as an immediately necessary and says, by the way, do you want to see my record? And you can see that, you've then 3 steps further ahead because you then know what I'm up to. You know that, you know, which doctor it is, so if you need to speak to me, you can contact me or ring up the surgery or whatever it might be. And you can ask the question, well, which rheumatologist are you under? And that's where the patient access to records becomes very, very powerful because it's somebody else who can see that information. Of course, the other one is the patient can see it as well, so they're now on my page as well. And they now know, gosh, doctor doesn't really know why this is, but it must be serious if he's emailing and not just writing a letter. That's when you click on the I button for that, renal failure unspecified, this is what you get. So again, it's not a Google search with 10,000 websites to look at. It's a handful of websites, all of which have been vouched for, which give you more information about it. Letters, test results. We talked about test results and patients having access to them. This is what it looks like. And you can see their cholesterol, what the result is, what the normal range is. Do you use the IT system to file? Yeah, so when you type in a message, you know, abnormal or needs appointment or whatever, that free text goes there. So the patient can see that cholesterol, abnormal, and again there's a little I button there. The screen that you can see now is the new screen at the moment, and they're still developing it. But what I've done is I've just switched over to the old version of patient access, which is still available and you can use it. And this is what it looks like, it's the same information on that screen. And if you click on the I button there, it takes you to lab tests online, which tells you about the cholesterol test result. What is it, why get tested, when to get tested, sample record. Common questions. My doctor told me I had a high cholesterol, but instead of treating me, he told me wait a few months and test it again. What I found is that when patients have access to this information, they don't ring up the surgery to say, what does that test result mean, it's abnormal. Most of the questions get answered by this link to lab tests online. Letters, you can see all the letters that are there. At the moment, this is what it looks like. It's a little bit harder, so you've then got to sort of scroll to have a look at the whole page. But on the old system, that's what the letter looks like. It's very clear to read. This, by the way, the Mickey Mouse Teaching Hospital, was done by one of my patients who said the test record doesn't have a letter on there because I can't scan a real patient's record letter in. So the patient said, well, can I do a letter then? And so they've done a funny little letter. It's well worth reading it. But again, it's a beautiful example of the partnership of trust. Now, a patient has decided, they've obviously had a lot of contact with hospitals, and decided to take a Mickey Mouse one. In the medication section, you can see the immunisations that patient has had. So imagine a baby who's got a rash. Are they fully up to date? Well, you'd be able to see all the immunisations they've had. Current medications, repeat medications, and then further down, past medications. Records by system, it's the same thing as what I said with the summary care record, but you can then look at specific aspects. So for instance, if we go into prevention of disease, you can see all these things that have been going on to try and prevent illness. So spirometry screening, mental health reviews, etc., etc. It's just a way of presenting the information that's in that record in a more meaningful manner for the patient.